Good afternoon to all. So we have gone through the series of lectures which were pertaining to adulthood psychiatry. Now we will look what are the disorders there in the childhood, infancy and adolescence pertains to psychiatric disorders. So this is the first lecture which consists of disorder of psychological development. The chapter F80 to F89 is prescribed for these disorders. In introduction, what is the background of these disorders are? There is an onset that is invariably during infancy and childhood. So, onset is usually occur in the earlier period of lifespan. An impairment or delay in the development of functions that are strongly related to biological maturation of CNS. A steady course that does not involve the remissions and relapses that tends to be characteristic of many mental disorders. So this is a continuous course of illness in these disorders, and there is no episodic course, and somewhat fluctuations may be there. These disorders pertains to language, visual spatial skills and motor coordination disorders. So impairment shows a gradual reduction as children age, although some milder deficits may persist into adulthood. So gradual reduction in the area of language, motor skills and others may be found, and which is gradually worsening as the child ages. Generally, the developmental history indicates a delay or impairment that has been observable without any preceding phase of normal development. So there is no normal developmental phase before the symptoms are actually found. These conditions are significantly more prevalent in boys compared to girls. A prevalent family history of similar or related condition may be found in the family history, and this suggests a genetic contribution to these disorders, though not found in all the cases. Environmental influences can affect the developmental functions involved that typically do not play a dominant role. So environmental influence does not have any dominant role in development of these disorders, but they may contribute. The specific cause remains largely unknown. In the continuum of disorder of psychological development, there are four types of disorders related to speech and language, scholastic skills, motor functions, and pervasive developmental disorder, which consist of autism, Rett syndrome, Asperger syndrome, and others. Let's start with the specific developmental disorder of speech and language. Just look at the category. There is what specific developmental disorder. So these disorders are specific to speech and language, and other impairments of cognitions are not usually found. So these are divided into specific speech articulation disorder, expressive language disorder, receptive language disorder, acquired aphasia with epilepsy, known as Landau-Kleffner syndrome. In specific developmental disorder of speech and language, so the first difficulty to diagnose these disorders are differentiation from normal variations in development. You know that as the child grows, there are certain impairment, and there are some mistakes in their language and speeches, which is expected as per their age. So this is a difficulty to differentiate this speech and language disorder sometimes. Most of the children ultimately acquire a normal level of language skills and have multiple associated problems. So as these children ages, they can have multiple associated problems also, like abnormalities in interpersonal relationship, emotional instabilities, and behavioral disorders. So how to differentiate these disorders from a normal development? So one have to look for the severity, course, pattern and associated problems with these children. The second challenge in diagnosis is distinguishing between language delay and mental retardation or global developmental delay. So in mental retardation, there is a global developmental delay in most of the areas of cognition and motor skills, but as this is prescribed as a specific developmental disorder, the specific problem is found isolated in these children. If global developmental delay is found as a diagnosis, the appropriate coding is F70 to 79, which is meant for mental retardation rather than F80. The third challenge involves distinguishing this condition from the disorder that arise due to severe hearing loss, specific neurological or structural issues. So if a child is having hearing loss, that deprivation can lead to development of speech and language disorder because of deprivation of senses. Any speech issue caused specifically by cleft palate, which is a surgical problem, or by dysarthria related to cerebral palsy would not be included in this category. Now in language and speech, there is a specific problem which is known as speech articulation disorder. What is the normal about articulation is by age 4 child makes error in speech sound production, yet they can still be easily understood by strangers. By age 6 to 7 most children will have mastered the majority of speech sounds. This typically does not hinder communication. By age 11 to 12 children should have nearly completed mastery of all speeches sounds. Now what is abnormal in articulation is the acquisition is either delayed or atypical for sounds, resulting in issues such as misarticulation, like omissions, distortions, substitutions of sound, inconsistency in sound production. So this diagnosis should be considered only when the severity of articulation disorder exceeds normal variation for the child's mental age. The child's mental age should be considered for diagnosis. Non-verbal intelligence is within the typical range. So non-verbal intelligence like gestures, smiling and other uh, bodily uh, cues are within typical range or within normal range. Expressive and receptive language skills are also normal. So specifically articulation problem is there. And it is not linked to any sensory, structural or neurological problems. So there should not be any physical problem or neurological problem or structural problem of development. The mispronunciations are clearly unusual within the context of child's cultural language use. The cultural language use should also be kept in the mind. Here are the examples of these problems. Like for substitution, the word is pronounced for red. Distortions, changing a sound which might seem like a lisp when S sounds like tha. So for sounds, example for sounds, it may be pronounced as thouns. Deletion, leaving certain sounds of their speech altogether. For example, never using SC in school and scratch. Addition, adding sounds or syllables to words that do not belong there. For example, to play instead of play. So UH is added to the word play. Now come to the expressive language disorder. This is a developmental disorder where a child's ability to speak expressively is significantly lower than what is expected for their mental age. while their understanding of language remains normal. So the child is not able to express his thoughts, but his understanding of language remains normal. Means if someone is speaking to him or her, they will able to understand that, but they are not able to express. This can be indicated by the absence of single word by the age of 2 years and the failure to generate simple two words phrases by 3 years should be taken as significant signs of delay. Difficulty include in diagnosis of this expressive language disorders are uh, the difficulty the children face because of this expressive language disorder are they have restricted vocabulary development. So vocabulary of these childs are very less. They will overuse the small set of general words. So vocabulary is less, then they will use lesser amount of words. Difficulties in selecting appropriate words, word substitutions, short utterance length. The length of sentence will be short and not descriptive in uh, details. They will have immature sentence structure, syntactical errors, especially omission of words ending or prefixes, misuse of or failure to use grammatical features such as prepositions, pronouns, articles, and verb in their language. Noun inflections may be there. For example, the base word is fox, which is inflected as plural foxes. The run will be inflected as present participle as running. So what is syntax? Syntax in English is the arrangement of words and phrases in a specific order. If you will arrange the words in a specific order, then only the sentence makes a sense. The additional points are the diagnosis should only be considered when impairment is significantly beyond for their mental age. So mental age should be considered, while their receptive language skills remain mostly within normal limits. Non-verbal communication methods like smiles and gestures should generally be functioning well. The child will still try to communicate despite their language challenges, often using demonstrations, gestures, miming, or non-verbal sounds to express themselves. So they are not able to express by means of language. Challenges faced by these children are difficulties in peer relationships, making good friendships, emotional issues, behavioral problems, hyperactivity and inattention are often seen, especially in school age. They have limited participations in conversations, or a lack of stimulating environment can significantly contribute in developing expressive language skills. So if the environment is less stimulating, if the activities are less, for example, in nuclear families, if both the parents are working and a child may remain at home alone or in with the maid or in the crutches, so there the interaction between the two people or more people are less with these children can lead to expressive language disorder. Now receptive language disorder. This is a developmental disorder where a child's language comprehension is lower than what is expected for their mental age. Now they do not understand, they do not receive what is spoken to them. This is indicated by not responding to familiar names by first birthday, by 1 year of age, not being able to recognize a few common objects by 18 months of age, not following simple instructions by age 2. So challenges they face in future involving struggling with grammatical structures such as negatives, questions, and comparatives, as well as not grasping more subtle elements of language like tone of voice and gesture. So if one speaks, they have certain tone and gesture associated with that. They are not able to understand the tone, whether the tone is lovable, threatening, or otherwise. This is outside the normal range of variation of child's mental age. The requirement for a pervasive developmental disorder are not fulfilled. So this is also a feature of pervasive developmental disorder. Pervasive developmental disorder consists of autism, Rett, Asperger syndrome, etc., but not fulfilling the criteria for those disorders. In almost all cases, the development of expressive language is also severely delayed. They have a problem in reception, can have problem in expression also. Socio-emotional and behavioral issues include hyperactivity, inattention, social awkwardness, isolation from peers, anxiety, sensitivity, and excessive shyness. When severe receptive language impairment is present, they may experience delays in social development. Social development means reciprocal relationship in the society. Repeat language they do not comprehend, they used to repeat the language, exhibit limited interest in subjects. They typically differ from autistic disorder, in which there is a they will demonstrate a normal social reciprocal interaction which is not present in autistic child. They engage in imaginative play. This is about the child who is having receptive language disorder. They engage in imaginative play. What is imaginative play? A child imagines a companion which is not present there, and the child used to talk with them and might be playing with a toy, and as if he is having another child along with him or her, but actually this is not there. So this is called as imaginative play. Seeking comfort from parents is present in receptive language disorder. Using gestures appropriately, which is not in the autism. Having only slight difficulties with non-verbal communication, which is more pronounced in autism. Now moving to acquired aphasia with epilepsy, a condition where a child who had been developing language skills normally suddenly loses both their ability to understand and express language while still maintaining overall intelligence. Abnormality in EEG readings are present, usually present in bitemporal areas. The onset between age 3 and 7, but it can occur earlier or later too. In about 25% of cases, language loss happens gradually over several months, but more frequently it occurs suddenly within days or weeks. In this syndrome, difficulties in understanding spoken language often emerge as first sign of condition. Some children may mute, while others may only produce sounds resembling jargon. In few examples, they lose normal variations in tone. Behavioral and emotional issues are frequent. The exact cause remain unknown for the syndrome, but clinical signs suggest a possible inflammatory brain process. So what is the prognosis for this syndrome is? The progression of disorder varies significantly. Approximately two-thirds are left with varying degrees of receptive language difficulties, while about one-third of these children fully recover. Now moving to specific developmental disorder of scholastic skill. Scholastic skills means the skills which are required in schools. Further classified as specific reading disorder, specific spelling disorder, disorder of arithmetic skills. So the common point for these subclassifications are these issues are not just the result of limiting learning opportunities. If someone does not get learning opportunities, they should not be diagnosed as having disorder of scholastic skills, and also not caused by brain injuries or illnesses. These disorders are believed to arise from irregularities in cognitive processing, primarily linked to some form of biological dysfunctions. So biological dysfunctions are there but are not exactly known. So there is problem in cognitive processing. The cognitive processing for psychology, you will have a lecture tomorrow. Uh, how a person perceives and what are cognitive process. This is more common in boys than girls. Again, to diagnose the scholastic difficulties, there are five types of challenges. The first challenge is it is essential to distinguish between disorder and normal differences in academic performance. We must consider the developmental timelines for two main reasons. For example, for severity, if a person is having language, the scholastic skill problems at the age of 7 has a different impact than the same delay at age 14. The delay is there, the child has come to assessment at the age of 7 and at the age of 14. The problem of these scholastic skill will be presented differently for both the cases. The changing pattern. The language delay in early childhood may improve in spoken language but can lead to specific reading difficulties later. So pattern may change. The difficulty in uh, reading maybe later may be present, but other problems are resolved. The third one is the teaching and learning scholastic skills are not solely based on biological growth. It also depends on the family situation, the education and personal traits. What kind of environment the child is having. Fourth one is it is important to distinguish between factors that lead to reading difficulties and those linked to poor reading skills that are not due to cognitive issues. Cognitive issues like neurological problems, cerebral palsy, and others. And the fifth problem is how to categorize them. There is a debate and about the diagnostic category to develop diagnostic category to diagnose specific developmental disorder related to scholastic skills. Similarly, the impairment are not directly caused by other disorders like intellectual disabilities, known as mental retardation, and significant neurological issues, unaddressed vision or hearing problems, or emotional challenges. These should be ruled out to diagnose. The cause of these disorders are unclear, but is believed that biological factors play a key role, interacting with non-biological factors such as learning opportunities and teaching quality. Children may experience a decline in academic performance later in their education due to factors like disinterest. In later period of their life, they may develop disinterest in studies, and this may be because of ineffective teaching also, emotional issues they are facing, or changes in workload. However, these issues are not included in the definition of diagnosis of these disorders. So diagnostic guidelines are, first there should be a significant level of difficulty in specific academic skill. The difficulty must be specific, is not generalized. The difficulty must be developmental, means it should have been evident during the early school years and not something that developed later. Fourth one is there should be no outside factors, for example neurological problems, biological problems, or social problems. The specific learning disorder should not be directly caused by unaddressed vision or hearing problems. Now come to the subclassification, specific reading disorder. This disorder is characterized by specific difficulty in developing reading skills. Children with specific reading disorder frequently have a history of specific developmental disorder of speech and language. If the child is having problem of speech and language, that can be reflected in the reading disorder also. Along with academic struggles, issues like low school attendance and difficulties in social adjustment are common challenges. The diagnostic guidelines are there may be error in oral reading skills such as shown by omission, substitution, distortion or addition of words or parts of the words. Now these difficulty in the reading which we have learned in the language before, now this is found in the reading part of the child. Slow reading rate, uh, false start of the paragraph, long hesitations in starting reading or loss of place in the text and inaccurate phrasing. Reversal of words in sentences or of the letters within words while the child is reading a book, paragraph or some written material. There may also be deficits in reading comprehension as shown by, for example, an inability to recall facts read. The child has uh, read the paragraph, but he is unable to recall the facts what was there in that paragraph. Inability to draw conclusion or inferences from material read. They may read, but they may not able to conclude what is there in the written material. Use of general knowledge as a background information rather than of information from a particular story to answer question about a story read. The child has read a story, but he used his general knowledge to answer the questions pertaining to that story. Emotional and behavioral issues are often seen in school-age children. Emotional problems tend to arise more in early school years. Conduct disorder and hyperactivity are more prevalent in later childhood and adolescence. Many children experience low self-esteem and difficulties with school adjustment and peer relationships. Specific spelling disorders. The child's spelling ability should be considerably lower than what is expected for their mental age, overall intelligence and school level. This is best evaluated through standardized spelling test given individually known as Spell 2 or test of written spelling 5. The child's reading skills should fall within the normal range. The child is able to read, but there are specific spelling disorder in writing. The spelling difficulty should not primarily due to poor teaching or be directly linked to major issues like with the vision, hearing or neurological function. Nor should they have developed due to any neurological, psychiatric or other conditions. So other conditions which may mimic specific spelling disorder should be ruled out. Specific disorder for arithmetic skills. This condition is characterized by particular difficulty in arithmetic skills. Arithmetic skills are skills in mathematics. The issues lies in the understanding of fundamental operations only, such as addition, subtraction, multiplication, and division. It is not related to mathematical concepts like algebra, trigonometry, geometry, and calculus. This is for simple arithmetic skills. The skill should be significantly below the level expected on the basis of age of the child, uh, his or her general intelligence and school placement, and is best assessed by means of an individually administered standardized test. Reading and spelling skills should be within the normal range expected for the child's mental age. So what kind of finding you will find in specific disorder arithmetic skills are: the child will fail to understand the concepts underlying particular arithmetic operations like addition, subtraction, division and multiplication. Lack of understanding of mathematical terms or signs. Failure to recognize numerical symbols. Difficulty in carrying out standard arithmetic manipulations. Difficulty in understanding which number are relevant to the arithmetical problem being considered. Difficulty in properly aligning numbers or in inserting decimal points or symbol during calculations. Poor spatial organization of arithmetical calculations and inability to learn multiplication tables satisfactorily. Now, specific developmental disorder of motor functions. The child's motor coordination, whether for fine or gross motor skill, should be noticeably lower than what is typical for their mental age and overall intelligence. So you are seeing that mental age and overall intelligence is the important aspect to diagnose these disorders. Developmental motor milestones might be reached later than usual. They may appear uncoordinated while walking and may take longer to learn how to run, hop, and navigate stairs. Learning tasks like tying shoelaces, fastening and unfastening buttons, and throwing or catching balls may be difficult. The child may show general clumsiness in both fine and gross motor skills, often dropping items, tripping, bumping into things like table and furniture, and having messy handwriting. Their drawing abilities are typically weak. They may struggle with jigsaw puzzles, construction toys, model buildings, ball games, and interpreting maps. And you can see that these requires a good motor coordinations. Significant neurodevelopmental delays are present, including coriform movements, mirror movements, and other. These are known as soft neurological signs. Tendon reflexes may be either heightened or diminished on both sides, but will not show any asymmetry. There is no identifiable neurological conditions like cerebral palsy and muscular dystrophy. Despite the signs and symptoms are seen as pertaining to some kind of neurological condition, but on imaging and other tests, these disorders are not identifiable. Complications during perinatal period, such as extremely low birth or significant prematurity, may be found in the history. Now come to the pervasive developmental disorder. Pervasive developmental disorder consists of autism, Rett syndrome, Asperger syndrome, and other syndromes also, which I have not included, but these disorders are important to know. Starting with autism. Autism spectrum disorder is a developmental condition that affects how individuals understand and interact with each other, which can lead to impairment in social communication and interaction. What happens in autism? There is a qualitative impairment of these interactions. But what happens in others are there is a quantitative impairment. Like in mental retardation, the quantity of interaction is reduced. While in this developmental disorder, known as pervasive developmental disorder, qualitative impairment is there. The quality of interaction is impaired. How the child is interacting with others. So it starts in early childhood and can lead to difficulties in social interaction, education, and employment later on. Many children display signs of autism within the first year of their life. A few children may seem to develop typically during this time, but experience a regression between 18 to 24 months. This is also seen. So how this social communication and interaction are qualitatively impaired. The example and signs are not responding to their name or seeming to not hear at times, resisting physical affection and preferring solitary play. What happens in a normal child? They usually enjoy the physical affection of others, but these are not fond of these physical affection, and they prefer play in solitary situation. Having limited eye contact, they won't make eye to eye contact while interacting with the other person. For example, if you interact with a child and the child will look into your eyes and may laugh or giggles, this is not present with the child having autism. They show little facial expressions. They have delayed speech or losing ability to use words or sentence previously known. They struggle to initiate or maintain conversations. often speaking only to make requests or label objects, using an unusual tone or rhythm in speech, which may include a sing-song quality or robotic speech, repeated words or phrases without understanding their context. They can repeat the words what they have heard from the person around him, but they do not understand the meaning or context of those words or phrases, having difficulty comprehending simple questions or instructions. They do not express emotions or recognizing the feeling of others. They seem to be cold emotionally, failing to point out or share objects of interest, approaching social situations inappropriately, like passively, aggressively, or they may become disruptive in their behavior, struggling to interpret non-verbal signals such as facial expression, body language, and vocal tones of others. In behavioral pattern, they will engage in repetitive actions like rocking to and fro, spinning movements, and flapping hands, participating in self-harming behavior such as biting themselves or banging their head, establishing strict routines or rituals. They follow a strict routine. For example, if one is going to school with a specific route, and if for a reason somehow their route is changed because of some reason, they will become upset even with the minor changes. They will experience coordination issues or displaying unusual movement patterns such as clumsiness or walking on tiptoes. They will walk on the toes, not with the flat foot, along with stiff or exaggerated body language. They seems to be stiff. They show a strong interest in specific details of object, like spinning wheels of a toy car without grasping the overall purpose of that car. So uh, they will limit their attention to a specific part of a whole object. Being highly sensitive to light, sound, and touch while showing little reaction to pain and temperature. Not participating in pretend or imitative play. Focusing intensely on a particular object or activity. Having specific food preferences, such as only eating a limited variety of foods or avoiding those with certain textures. Now, Rett syndrome, again, the cause is unknown, and this is primarily observed only in girls. Initially, children may appear to develop normally, often followed by a partial or complete loss of hand skills and speech, along with slowed head growth, typically starting between 7 and 24 months of age. So, the development at the age of 7 and 7 to 24 months, usually normal, then the child regresses. Their head skills and speech regresses, and head growth becomes slowed. The key features include hand wringing movements, hyperventilation, and a decline in purposeful hand use. Social and play development halts within the first few years, although interest in social interaction usually remains normal. They will also have truncal ataxia and apraxia, often accompanied by scoliosis and kyphoscoliosis, and sometimes chorioathetoid movements. Severe intellectual disability is common, and seizures often are arising during early and middle childhood. Have you learned about the Rett syndrome in your syllabus? The syllabus of BPT. Rett syndrome. No. Now, Asperger syndrome, a condition with unclear classification, this disorder features similar qualitative issues in social interaction as seen in autism. But the difference is the absence of significant delays in language or cognitive development. Language and cognitive development are intact, but they have qualitative issues in interacting with other peoples around him. Most individuals have average intelligence, although many may exhibit noticeable clumsiness. This is commoner in boys. The ratio is 8 is to 1. The symptoms often continue into teenage years and adulthood. You must have seen the movie Lal Singh Chadda. Have you seen? No. That character resembles the Asperger syndrome. He had difficulty in social interactions, but language and cognitive development was intact. And he also had average intelligence. And so, for conclusion, we have learned about the disorder of psychological development in infancy, childhood, and adolescence. This has main four classifications, which pertains to speech and language, scholastic skills, motor functions, and pervasive developmental disorder. In speech and language, we learned about the specific speech articulation disorder, expressive language disorder, receptive language disorder, acquired aphasia with epilepsy, specific reading disorder, spelling disorder, arithmetic skills. Mixed disorder of scholastic skill means if components of reading, spelling, and arithmetic skills are found together, then can be diagnosed as mixed disorder of scholastic skills. In pervasive developmental disorder, we learnt about the autism, Rett syndrome, and Asperger syndrome. Thank you.